Welcome to Consumers Doctors channel on the behalf of Foremost Organization. It has been a while since I've been streaming live. Thank you for joining us. I've been passionate about healthcare delivery in this country. Do you know the sickest among us is only 2 to 3% of the population? You mean to say when we are spending $3.8 trillion on healthcare and still ranking 37th, 38th among the most advanced countries, I can't fathom that we can't take care of the sickest among us. So let's look into it, folks, how we can handle this troublesome aspect of impaired health support plans. What is the eligibility for the impaired health support plans? Providing eligibility to both uninsurable individuals and small group members will provide a target support, choice of plan options, and affordable health insurance for the sickest among us, which is only 2 to 3% of the population, folks. So, before Obamacare, many consumers avoided applying for insurance because they feared failing strict insurer underwritings. They failed in those underwriting standards. They're worried about their privacy, folks. Worried about their privacy. They were concerned that any poor health characteristics would become a part of their electronic record that could affect their personal or business needs. They worried about the exposure of marijuana and other drug use. Under the personalized health insurance, people with medical issues can apply for insurance. Yes, they can apply for insurance without fear of reprisal or stigma under the plan I'm suggesting, which is a consumer driven, personalized health insurance option. So, who is eligible for an appeal? To the Health Review Authority under the public private partnership. There's no government involvement here. Is under the public private partnership. Health Review Authority, a likely candidate for the impaired health support plans. The answer is, again, I'll ask you this same question again. Who is eligible for an appeal to the Health Review Authority? The answer is any individual who has applied to a licensing participating insurer. Number one, has been rejected for the coverage by an insurer. Number two, is unable to agree with an insurer on alternative that allow for a premium of less than 25% over a standard premium rates. And number three, insurer proposing contract benefit limits of 25% or more of the policy value. Or number four, any combination. Anyone who is a part of a group 50 or fewer employees, 50 or fewer employees, and has a medical condition and or a history that causes the group plan to be priced at 10% or higher than the otherwise rates, standard group rates. An applicant, an applicant determined by the Health Review Authority to be truly uninsurable, will automatically qualify for the impaired health support plans. Yes, impaired health support plans. And applicants can then select multiple plans offered by the impaired health support plans under this umbrella. You may be thinking, that sounds reasonable. You may be thinking that sounds reasonable, yes? Are there any additional requirements? Yes, there are additional requirements, like any individual must be a legal citizen of a state for at least 12 months prior to the application to the insurer. Yes, at least 12 months. Let's get specific for the policy wonks out there. Following are not eligible for impaired health support plans. What are they? Number one, anyone eligible for health insurance benefits under Medicaid, they're not eligible. Anyone eligible for another state or federal plan coverage or program, including but not limited to Medicare, TRICARE, or Veterans Health Care, they're not eligible. Number three, inmates of public institutions. Anyone eligible for existing public programs are not eligible in these impaired health support plans. And number four, anyone eligible for self-insured employer coverage. Self-insured employer coverage are not eligible. And number five, anyone who voluntarily terminated coverage in an impaired health support plan within past 12 months, yes, within past 12 months are not eligible. And number six, anyone on whose behalf an impaired health support plan previously paid out 1 million or more in benefits are not eligible. Any person who no longer meets the impaired health support plan eligibility requirements may be terminated at the end of the earlier policy period or at an enrollment in other coverage. And impaired health support group plans cannot be rescinded unless their application was approved due to a fraud and material representation. They will not be eligible. And who else? There are also some limits in smaller groups. Employer groups of 50 or fewer employees must not have been insured during at least previous 6 months. Yes. And another group, for group plans renewing with the same insurer at the first annual policy anniversary within 12 months, insurers may, at their option, apply for a health review authority and members or family members to be considered for the impaired health support coverage. There are rules, folks. There are rules. People who are the sickest among us, we can provide the care. Yes. Under the public-private partnership, of course. And it's very affordable, transparent, and it's competitive. These are the ground rules for the people who wants to have, who are eligible to these health support plans, impaired health support plans. It's all monitored by the Health Review Authority under the public private partnership, folks. If you understand what I'm trying to say, Health Review Authority is a central agency under the public private partnership. They will be monitoring who are eligible, who are not eligible. But the people who are really sick or truly uninsurable, yes, they will be eligible. So everyone will be covered under this plan. I hope, I hope I clarified for especially for people who are uninsurable and small group members. This is the way to tackle the situation for the uninsured group and small group members. Thank you for listening. We will see you in the next episode of Consumers Doctors Channel on behalf of Foremost Organization. Thank you very much. Goodbye and God bless.